Welcome to WGSN-DB Going Solo Network. This is a senior citizens forum, and it's being sponsored by Benefits4U2 Insurance Services. And I'm your host. And at a senior citizens forum and Benefits4U2 Insurance Services, we believe that knowledge is power, and knowledge can save you money. So today we're here with Lauren Starkis-Stokes.
Hello.
I got it wrong. It's Lauren Stokes-Starkis.
Yeah, whichever order, doesn't matter.
Okay, doesn't matter. Okay. And if you remember Lauren from the past, she is my assistant. And we did a show
a couple months back.
Yeah, a couple months back. And we were real happy to find out that it had a lot of views, our show. And from doing that show, we thought we would build off it and talk about benefits and what they are, and mostly looking at the definitions of what those different means towards your benefits. So we're happy to do that today. And are you ready to
Let's get going?
Right. So I'm going to ask Lauren real quick, a quick question. Why do we need insurance? Any kind of insurance?
Because we never know what's going to happen in life.
Absolutely. We never know what's going to happen in life. And I'm going to refer back to my family. Okay. I have a niece. Of course, she has her husband, and she has 4 little girls. And I want to start with last year. The little girls were 7, 4, and 2. And they considered themselves an extremely healthy family. They were out doing all kinds of activities. So last November, one of the little girls, who was a twin, one of the twins, got sick, went to the doctor a lot. They tried to do different things, give her antibiotics. She would have a temperature, would go away. She felt terrible. 2 days before Christmas,
Goodness,
she was diagnosed with leukemia. You don't know when something is going to happen to you. You may think you're really healthy, and you don't know what the next moment brings. So if you work with, I have lots of friends that sell life insurance, and they will say, bad things happen to good people.
yes.
So what happens? Luckily, my niece works for a big financial institution, and she has group health insurance. It doesn't matter if you have group health insurance, you have individual health insurance, or you have Medicare group insurance, or you have Medicare individual insurances. It doesn't matter. You're planning for the unforeseen.
And you never know what happens. You could be walking down the street and something catastrophic can happen, or you could have this coverage and never need it. But you want to be on the side where you have it and don't need it versus not having it and finding yourself in a catastrophic emergency and not being able to afford your health care.
And healthcare is just really expensive. It's very, very expensive. So I thought this was a good time to put out this show, because it's not that far from the annual open enrollment periods or the annual election period for either Medicare or for people pre-65. Or I know I'm a part of a group plan, and I know that information is coming out in October. So, but I know what the definitions mean, but I like to educate. So we're going to talk about all the different definitions that will help you during this election period to change your plan as needed. I mean, and only you know what you need. So we're going to go through the very basic definitions. If you want to call us up on anything else, we will be happy to talk to you, either Lauren or I, to give you those definitions and what you should be looking for. We don't have every single solitary thing because we don't have enough time to cover it all.
No,
okay?
It's a big subject.
It's a huge subject. And it's not an exciting subject,
but it's important.
but it's important. So like in our previous show, we talked about you need to know your benefits, okay? Understand those bills when they come into you and question them. So I'm going to go back real quick and tell another story, going back to the same family, okay? So this year, the 2-year-old got sick, okay? And of course, they were going to the hospital. My other little niece, she was going in and she was getting her chemotherapy. And happened, my sister-in-law was visiting them, and the 2-year-old got sick. So one of the things that my niece said to my sister-in-law, and I just heard this story the other day, okay? Said to my sister-in-law was, when you go into the admissions office or when you go in to talk to them about insurance coverage, I owe them nothing for the rest of this calendar year. Do not let them put a bill on. Yes. And I knew exactly what my sister-in-law was talking about, because the cost of chemotherapy is crazy. It's crazy expensive. It can be anywhere from $10,000 to $20,000 a session.
Oh my goodness.
Okay. So you need to know. So what your coverage is going to cover that. All right. So, and I thought that was really smart of my niece to tell my sister-in-law that.
Yeah.
Yeah, because she knew, because they have the poor little girl is going through so many different sessions of chemotherapy. I can't even go through it. And the amount of hospital stays. Or a year ago today, that family would never have believed that they were living through this. They thought they were healthy. They thought they could go hiking, they could go skiing, either one, water or snow skiing. They could do anything that they wanted to do physically with their daughters, okay? So you don't know. So we're going to start out with our presentation, okay? I'm going to bring up some slides, and I'm hoping this is going to help you out. Okay. All right. So these are our slides that we have. Is it just going to? Okay. All right. And we're going to start out with the very basic. So what is a premium? You want to say what a premium is?
All right. So a premium is going to be a amount of money that you're going to pay. It will typically be monthly, quarterly, or annually for your health insurance plan when you go for monthly.
Okay. And those premiums, depending upon if you're on Medicare or you're pre-65 or what your group plan has to offer, those premiums can be $0. Those premiums can be $3,000 a month.
Yeah, each plan is going to have very different premiums. So that is something you're going to want to look at when you're finding which plan is correct for you.
Now, I know I've been doing this for 15 years, and I know one of the questions that I'm going to get during the annual election period is, can you just tell me, Janice, off the top of your head, what my premium is going to be? I don't know what your premium is going to be, because it depends upon what you're looking at, okay? So if you're coming to me and you are under the age of 65 and you're single, depending upon what your health condition is, I don't know what your premium is going to be. Different medical groups take different types of plans. So you have to know what they are. So it can be anywhere from $0 to $5,000 according to what you're selecting in a plan. Yes. Okay. But my favorite one is, what's the deductible? Everybody wants to know, what's the deductible? So what's the deductible?
Yeah. So the deductible is going to be the amount that you owe for the healthcare services before your health insurance plan will begin to pay for other services. And with that, deductibles are going to vary from plan to plan, and they don't apply to all services that you may need. Typically with the deductible, you're not going to see that before you go in for your annual physical. You're not going to see those for preventative appointments. And also you have to know deductibles can be very different based on a plan. You could have a deductible as low as $500, or you could be getting services like we're talking about with chemo and have a much higher deductible when we're starting to look at $20,000, $30,000.
Right. And if you're on Medicare, there's some of them, may not be a deductible depending upon the plan and the area you live in. Now, some of the plans may say, and we're going to go give you the definition in a couple of seconds. I lost it. Okay. It's a co-payment of $50 after you pay the deductible. It will state it, but sometimes the plan will have a copay of $50 and it won't say after the deductible. So you have to watch what it is, because if it just says $50 for that particular service, you're going to pay the $50, but it says after the deductible, you have to pay the deductible first.
Yes.
Okay. This is a word that people just don't really understand. It's called a maximum out of pocket, sometimes referred to as a MOOP, that's M-O-O-P, okay? But I like the word maximum out of pocket. So when I was talking about my niece being in the hospital with both her daughters and going in, she was talking about she already paid the maximum out of pocket for that calendar year. So the calendar year is from January until December. Everything always starts all over in health insurance every January.
First of the month, every January.
Every January, everything starts over. Okay. So what counts in the maximum out of pocket? Your co-payments, your co-insurance. Also, your deductible, what's not on here, counts as the maximum out of pocket. That's for network care, and that could be also for out-of-network care, okay? And that means at that point, may it be the middle of January, or is it in November that you reach that maximum out of pocket, the plan is now responsible for paying everything. And again, like you see at the very bottom here, that can be $500 your maximum out of pocket, or it could be $50,000, depending on the type of plan you have.
And that's why it's very, very important to go over the stuff with your agent every year to make sure you still have a plan that's going to be right for your health, and also that you can financially afford. If you can't afford, a $50,000 deductible, depending on the plan, that's when you want to make sure you're looking at other plans and really reading the material that you have in front of you.
Yeah. So like with my niece, okay, she didn't start getting all these bills last year until November, but they hit their maximum out of pocket, I believe, before January even ended in this calendar year. I mean, because even she had surgery this year. So it was a minor surgery, but she had surgery. So, and I know my poor little 4-year-old, now 5-year-old, has been in and out of the hospital with long hospital stays. And it's just so costly. Here is a copayment. I mentioned a copayment a few minutes ago. It's a fixed amount that you pay for your medical service. So if you're going to the doctor's office and you're seeing your primary care doctor, it could be a zero copay. I'm just giving you examples because the scenarios can be completely different. You can also go to see your specialist, and that may be $45 copay. Depends again upon what your plan is. So I can't give you an exact amount because each plan is different.
Yes.
And what they have to offer. Now, one of the things Lauren already has said it, okay, is that You need to review your benefits on an annual basis. You need to review those benefits for several reasons. One, you want to see what changed, but you also want to make sure that your doctor is still contracted in that plan, because doctors are moving around. Okay. Oh, prior authorization. Tell us all about that.
This is a good one. So prior authorization, what this is this is going to be a approval that you need from your health plan that may be required before you get a service or fill a prescription in order for that service or prescription to be covered by your plan.
Okay. And one of the reasons why they do that is that they're trying to keep the cost down. We all will agree with that. And the insurance companies or the plan, the carrier wants to make sure that you are getting a service that you actually need. Because lots of times there's services that are not needed. I know we hear horrible stories about insurance companies not approving things, but I can't go there with that, with this session.
We do have some examples.
Okay.
Got a little out of order.
Well, here's a little of, to make sure the procedure is medically necessary and to keep the cost down. We covered that. Okay. All right. A co-insurance. I don't like co-insurances. And I'm going to tell you why, because we're going to look at it. We're looking at it right here. Because the co-insurance is always a percentage. And we have some examples here. So if your insurance says that you pay 20% for that particular procedure, okay, 20% of what? It's like going to a sale. Oh, we're discounting this 10% off of what? Okay, so I don't know what they're going to charge me.
Each different plan will have different percentages of co-insurances, and that goes different plans, different companies, and that's even for different procedures. You may only need to pay 10% co-insurance of an x-ray, but you may need to pay 50% of your chemo. That's another thing. You have to make sure you see what percentage you're paying on those services, because co-insurance could be very small, it could be very big.
Well, it depends upon the procedure that you're having. Okay, so right here, Lauren has a really good, we have an example up here. If you have $100, your insurance is going to pay 80%. That's going to be $80. You're going to pay 20%, which is going to be $20. That's not a big deal. But what happens if you have a $10,000 service, okay, and you're paying 20%? Now, all of a sudden, there's zeros added on to that.
Multiple zeros.
Multiple zeros. I mean, so if you have $10,000, it's now $8,000 the plan is going to pay, and it's going to be $2,000 that you're going to pay. Now we're talking bigger amounts of money. And we're just using round figures to make it really easier to understand. And I don't like not knowing what I'm going to be paying.
Yes.
It's really scary. Okay. Okay. So now you hear people talk about HMOs and PPOs.
Yes.
Okay. And things have changed since the pandemic started.
Yeah.
Okay. They've changed, maybe not so much because of the pandemic, but technology has changed a lot since the pandemic. Okay. And we're going to talk about now, what is an HMO?
All right. So with a health maintenance organization, or HMO, that is going to be a type of health insurance plan that limits coverage to care from doctors who work for or are contracted with that health maintenance organization. So with that, it's gonna generally won't cover out of network expenses unless you are in an emergency situation.
Very good. That was very good explanation. Okay. So I hear people talk about, and you and I have talked about this a lot, referrals. And my experience in the last year is if I needed a referral and I call on my own to get the referral, I usually have to wait a long period of time. But once I get into a doctor's office, like a primary care doctor's office, and I get that referral, before I even get back to my car, that referral is done.
A couple months ago, I needed a referral for a procedure and was very surprised that my phone was dinging me that there was already a text that referral had already gone through and I was already approved for those services. Like we were saying, with the pandemic happening, it has sped up some of these things versus 20 years ago when it could take 2-3 weeks to get that referral.
Even 3-4 years ago. Okay. Because right now, because of, and it also depends upon your medical group too.
Yes.
So if you go to a big medical group, they usually have an app that you could put on your phone and it clicks in. Now, I just had the experience with, I'm going to go talk about PPO, but that's back into the PPO. But what I'm talking about, I go to a big medical group, Lauren goes to a different medical group, and we have something that the medical groups have, and I can go in and find anything I want to know about my medical history when I click on it. Smaller medical groups may not have that, okay? But even your HMO providers will have that. Now, one of the things with, if you have, I call pre-65 health insurance, you want to make sure that your doctors take an HMO. There are a lot of doctors that don't take HMOs. They will only take a PPO. So you really need to know and look. So now I talked about PPO, which is a preferred provider organization. So you get to see how well you do with this one.
All right. So preferred provider organizations, or PPOs, are a type of health insurance plan that contracts with participating doctors and hospitals. You are going to pay less if you use those doctors or hospitals that belong in your network. You will be, with the PPO, you can use doctors and hospitals that aren't in your PPO network, but you will pay additional costs if you want to see those particular doctors or go to those particular hospitals.
Right. And that's real important to know, because there are many, I go to a medical group that only takes PPO. Okay. And there are doctors that only take PPOs. So when you're looking at your medical plans, you have to find out what plan your doctors take. And if you live in a big cosmopolitan area, in-network is easy to stay. But if you live out in a smaller rural area, it's not as, the doctors may not all take everything. And on our previous show, we talked about in hospitals, having contracts with a third party. That third party may not be contracted with your insurance plan that you have. So it's all important to know what is being covered.
And it's very important when you're looking for a PPO or an HMO to make sure you go to your agent with your doctors in hand, and we could check that for you. We could see if these plans take, or if these doctors take these plans. It's easier to do it that way versus not, if you don't bring anything to your agent, you could be signed up for a plan that your doctor doesn't take, and you get a surprise when you go to get that physical and they're no longer taking the insurance.
Last year at the end of the Medicare annual election period, one of the big medical groups stopped taking a specific carrier. Okay. And we didn't even know about it until I think it was the last 10 days.
Yes.
Okay. So we had to go out, contact our clients that had that particular plan, picked up a couple of new clients because of that. And they just don't take that plan anymore. So it's real important to know Also, if you have an HMO, maybe your group only takes that HMO or only that PPO. Because again, there are medical groups that may take one provider that only provides the PPO, but not the HMO. So it's real important to know. And the sad part about this happens every year. There's always the medical groups and the insurance companies are negotiating. Why? I want to say, why aren't they doing this before this all ends?
Yes.
No, they're negotiating, and we have to get things taken care of. And it's real important to know. Again, we're going to stress the same thing we stressed on our other show. Know your benefits. Know these words that we're giving you today. Okay.
All right, and that was it for our definitions.
Yeah, so that was really great for our definitions. If you would like to have a copy of our definitions, you can email us and we will send you out a copy of these definitions, and we'll probably have a few more definitions on there that we didn't cover today. But one of the things that happens annually, and I know I've already started getting ready for the annual election period that's coming up for Medicare, and that's coming up for I call pre-65 insurance. Again, look at everything. The prescription drugs are changing, especially in the Medicare world. What things cost today may cost different starting January, all right? There may be areas where things have gone up because there's thousands of different things that you need to look at. We didn't talk about, we're going to take a quick break right now, and we come back, we're going to talk about prescription drugs for a few seconds, and we'll be back. This is WGSN-DB going solo. Now we have a word from our sponsor. Thank you.
Here at Benefits4U2 Insurance Services, we believe knowledge is power when it comes to selecting the correct healthcare and Medicare insurance. Please contact us at healthcareoptions@benefits4u2.com or call us at 310-245-0332.
Welcome back to WGSN-DB going solo. This is the Senior Citizens Forum. I'm Janice Wood, and I'm here with my trusty assistant, who is my guest, Lauren Stokes-Starkus. It's a mouthful.
Yes, it is.
And I saw somebody's name the other day whose name was Starkus. I was like, I don't remember where we saw that. Okay. So we were talking, we gave you in the first half of our show today, we gave you a lot of different definitions. We didn't give you all the definitions, but we gave you a good portion of them to digest, okay? And now what we didn't talk about was prescriptions, okay?
Yes.
Prescriptions is a huge, huge subject all on its own. And has its own vocabulary. It also has deductibles, and it has, in the Medicare world, it has something that's called troop. And that's like a maximum out of pocket. In the pre-65 world, or those that aren't on Medicare, okay, it also has different things to look at, okay? So in the pre-65 world, you're going to look at, they have tiers, and they also have tiers in the Medicare world, okay? And the tiers are 1, 2, 3, 4, 5, sometimes it's 6. And according to the tiers, tier 1 would be your generic
medications.
Yeah. And your tier 2 is usually your non-preferred generic medications. Tier 3
It's going to be
your brand names. And for 2023, a lot of your insulins were coming under tier 3. Okay. And tier 4, life's getting more expensive.
Yes. Tier 4 is typically where we get into the co-insurance and we start getting into the percentages.
Well, no, well, it can be both. It can be both. Okay. So if you remember that a copay is a flat rate, and they want you to stay with either a preferred pharmacy or a standard pharmacy. So these are more words for you. We're going to go back and talk about that in a second. So that's tier 4, and tier 5 can be you're paying a percentage of something depending upon the plan. Okay. In the Medicare world, it's more like majority, but not all. It's 33%. Yes. But not all plans are that way. Okay. Some areas you have deductibles. Some areas you don't have deductibles. I'm not going to spend a lot of time in the Medicare world, okay? Because we're going to be doing a show very soon, a Medicare 101, where we'll go into more of that in depth. But for this show, as long as you have an understanding of it. Now, I used this example earlier, is that, okay, you're going to spend on a tier 2 drug, you're going to spend $35 after the deductible. So remember, we used that earlier when we talked about deductibles. Or your plan could say the maximum prescription is going to be $250. You're not going to pay any more than that. Yes. Okay. So you just have to look at and know what you're taking.
And it is also very important to know what the formulary is when it comes to your plan. So a formulary is going to be a list of covered drugs that you can get with your plan. That's very, very important when you're picking out a plan, because something on one plan, a tier 1 drug, may be a tier 4 on a different plan. So you have to look at your formulary to see what is and is not covered with your plan.
And every year, the formularies change. I know this year, more in the Medicare world, there's going to be a lot of difference in the drugs. And there's a lot of negotiating going on about these particular drugs because they're so expensive. Now, a few minutes ago, I talked about a standard pharmacy and a preferred pharmacy. So what's a standard pharmacy?
A standard it's easier for me to start with preferred. When you go to a preferred pharmacy, that's going to be a pharmacy that your plan wants you to go to. They're contracted with a preferred pharmacy. So once you go to a standard, that's going to be a pharmacy that your plan isn't necessarily contracted with, versus your preferred ones that they want you to go to and they are contracted with for your medications.
Yeah. And it's real important. So the other thing that I would say for you to know is that I know a lot of people, because prescription drugs are so expensive, they only want to buy it 30 days at a time. Yes. Okay. But you may save money by buying it at 90 days at a time. So you need to look at that and work it out in your budget, what it is. Now, I always tell people, if you're starting with a new prescription, go with 30 days. Yes. And the reason you go with 30 days is because you can't return a prescription drug if it doesn't work for you, like you could return a pair of shoes. Yes. Okay. Yeah. And I much rather pay that. Once I know the drug agrees with me, then I'll go with the 90 days, unless there's limits on the drugs.
Which that's another thing that will show up in your formulary, is if there are quantity limits on certain drugs for certain reasons.
For certain reasons. Now, I looked up a drug the other day, and you can only get it for 30 days at a time. That's all they would give it. Why? I don't know, because to me, it didn't look like it was a narcotic or an opioid, okay? But that's all you could get it at, is at a 30-day quantity. So there's all these different scenarios that are going on out there.
It's very important to ask questions. When it comes to asking your agent questions, there are no stupid questions. There's no stupid questions when it comes to having knowledge on your health care.
And I've had the experience this year where I've had questions come to me that I absolutely did not know the answer to, because that situation never came up. I had a client call me up and he started talking about, why is this drug so expensive, blah, 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 blah. And then I go finding out that he was taking a antibiotic, and he wasn't taking it by pill. He was taking it intravenously at home. Okay. And that made a difference on what his costs were. So I couldn't find the drug under his plan. So I called the plan up to research what was going on. And it ended up that it was paid in a different part of his plan. And that's why he was paying what he was paying. Because when I talk to people, it's usually like, if this drug is administered in the doctor's office, it comes underneath there. But there's always something. And at Benefits4U2 Insurance Services, we'd love to do research and learn new things.
Yes. We love having the questions. We love doing the research. We love taking care of you guys, and we want to make sure you have exactly what you need for your conditions, for your lifestyle, for everything.
Yeah, because there's 1,000 different scenarios out there, because the human body has so many things that can happen to it. There's no way to even fathom how much can go wrong in the body, but you need to know your benefits. And we can't express enough, if you're talking to us or you're talking to another agent, make sure you know your benefits, because it may save your life. But the good thing about this is we do have these annual election periods where we can change our insurance. But if, say, my niece, at the story that I told at the first part of the show, didn't have insurance, what would have happened?
We can't even fathom.
We can't even fathom what would have happened. And she was a family. They were active. They traveled. They skied, snow skied, water skied, hiked, traveled to different parts of the world. And they took the kids with them. Okay.
And that's why it's so important to be covered. You never know what is going to happen or when it's going to happen.
Yes, it is so important. And as the life insurance guys say, bad things happen to good people. And you may be driving your car and paying all those insurance premiums for years, and you never have an accident. But that one time you do, it's there. And I know because I do this. This is my expertise. Health insurance is extremely expensive. And I feel sad that people have to pay it. I'm part of a group plan. Lauren's husband is part of a group plan, so I don't have to worry about providing her insurance. Yay, okay. But there are different plans out there. So if you see a plan that says to you, we can save you $600 a month, make sure you compare the benefits. Make sure that what if something does happen? Is there a cap to it?
Well, in those plans that advertise saving $600 a month, you won't be saving $600 if you don't have benefits that cover your needs.
Right. So that's also very important. Remember to do that. Now, I'm part of a group plan, okay? And I just got a notice that they're going to change my insurance. And I'm really happy with what I have this year, okay? And I'm like, you mean I've got to stop and look at this? Yes, I do. I do because I need to know what's going to be in store for me for next year. Now, if you're listening to this and you're not in the Medicare world, it's even more important because that insurance is so expensive.
It is.
It's so expensive, and you need to look to see what it is. And I know Lauren, as soon as her husband comes home with the materials, she's going to sit down and go over it. And if she has any questions, she'll be coming to
Come
me.
right here.
Right. And we're going to look at it to make sure they have the plan that's correct for them. And she can tell you the story. Her husband got into a motorcycle accident. He slipped on some sand?
Going about 5 miles per hour, slipped on some sand, broke the collarbone.
And he was completely dressed.
Completely covered, thankfully, completely covered with motorcycle gear. But this happened 3 days before our insurance went into effect. And it was not fun. Not fun. You get big bills. You get a lot. You need to be covered. You never know what's going to happen. A small 5-minute motorcycle ride can turn into life and death without the correct insurance to help pay for those bills.
It can be life and death. It also can be financial death.
Mm-hmm. It absolutely can.
Yeah. So we don't mean to be scaring you, but we want you to make sure that you are looking at your benefits and you see what the changes are. There may not be a change. And you go, okay. Or you may go, oh, I didn't know that was covered. Because a lot of people don't even know what's covered, or do they know that they're using that is available to them. And we find that every day. We go into our clients' homes and they'll show us a stack of stuff and we're going to go, okay, we go through it and we explain to you what it is.
Everything.
We do it all the time.
Yes.
So I can't express enough how important it is to know your benefits.
And please, 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 if you have any questions, do not be afraid to reach out to Janice, or your agent to clear up any of those questions you may have.
And if you have a question that you want to post on Facebook, because this is shown on Facebook, and maybe a question somebody else has, and they don't know they didn't know how to contact me, post it on there.
We love questions.
And we love questions. So thank you very much for watching us. Thank you, Lauren, for being my guest again today. I always love doing these shows. Yes. I think we have the most informative show on WGSN-DB going solo.
We hope.
Well, I know we do. Okay. I feel like we are really providing you a service with information that's not so exciting, but so necessary to know about. So thank you.
Thank you.
Bye.